Hi, I'm Dr. Neel Shah, and welcome to the DBT Podcast. Welcome to another edition of the DBT Podcast. My name is Dr. Neel Shah. I'm a hematologist-oncologist, interviewing experts in their fields to learn more about science and the general reason we do the things we do, like go to the doctor or go to the dentist or go to the orthodontist. Today I have Dr. Keyur Shah here. Yes, he is related to me, although you wouldn't know it because he's about a foot taller. Dr. Keyur Shah, thank you for joining us today.
Thank you.
He's a doctor of dentistry and orthodontics, I believe. Maybe you can.
Correct.
And also has been helping people for the last 20 years, I think it's
Correct.
been. He practices here in Illinois. Madison Orthodontics, I believe, is the name. And, we're just going to talk to him. I think the first question I have as someone that is a lifelong Chicagoan, like, what was worse? If you had to have a tooth pulled out or watching the Bears game on Sunday? I'm just curious. What would be worse in your scenario?
I turned it off after a while, so I'd probably say tooth.
The tooth. Okay, tooth was worse than the Bears game. Ouch. Okay.
I turned it off.
Well, I was smiling the whole way, obviously.
I'm sure you were.
And
enjoy it for now.
We've been through. The Bears obviously won a championship in '84, and
86,
84?
man,
or '86,
yeah,
whatever.
Well, 85 Bears with 86 championship.
But,
yes,
I appreciated all the love I had last year. Most of my, like you, were all hoping the Lions would win for me, so I appreciate that.
We were going to go to the NFC Championship
absolutely.
The Super Bowl.
Yeah. So we're hoping.
Whenever they go, I'll come with you.
I know, people don't know your background, but, you did live in Canada for a short period of time, and, you're a Bills fan as well. So,
I am.
So it's good that they're in different divisions,
Absolutely.
So when the Bears, after they lose this next game, the chance of them making the playoff become really low, then you can just become a Bills fan for the rest of the time, because that's a great team.
We might just have to retire your 0-16 paper bag that I gave you a few years ago.
That's right.
Maybe I'm gonna adopt that at some point.
So speaking of going to the dentist, most people are more afraid of going to the dentist than going to the doctor. And I understand that because I've had those injections, deep cleaning, I think you guys call them. And I know you don't practice dentistry per se on an everyday basis. You do orthodontics, but, you're also a physician and have this training. And I'm just wondering, when did we figure out as humans, that maybe going to the dentist, getting our teeth cleaned, and doing all this stuff was so important for our health?
The history of modern dentistry is relatively, more recent. Ancient dentistry goes back to way BC. There are cavemen pulling out teeth that were infected and stuff like that. But modern dentistry in itself, has gotten very popular over the last 100 to 200 years. Started in Europe. There's a French surgeon that started dentistry in Pierre Fauchard in France, and he was a physician that really focused on how modern dentistry can
prevent.
improve.
It's all about prevention.
Exactly.
Is that
so
right?
They went through different periods of time. It was basically reactionary in the early ages of dentistry, and just like medicine was reactionary at the beginning, now it's more preventative.
Right.
And actually, we're going into the regenerative phase of dentistry these days as well. There's exciting things coming up in the future. Gene editing therapy will actually provide us technology to maybe, grow new teeth at some point.
Wow.
Yeah. They've been doing it in the lab for a few years.
Yeah.
And, once they can implant one of those and you don't need any fake stuff in your mouth, they take your own genes and grow you a new tooth.
So besides the aesthetics, people want to have straight teeth, and, we'll talk about that. But in terms of, why you get your teeth cleaned per se, is it really just prevention of infection and making sure that your teeth are working the way they should in terms of, obviously we get our cleaning, we get our x-rays. Is that the reason for doing that?
So the main thing is prevention. Obviously, daily care is the most important. A lot of it has to do with patient education of, how that relates to your overall health, how it relates to your dental health. You're using your mouth every day unless you're on a, no eating diet like we are sometimes. But part of it started with prevention, started with fluoridating the water to prevent cavities. And cavities are more of a modern dilemma because of refined sugars and carbohydrates that we've started consuming more over the last couple hundred years. And fluoridation has helped. There's a lot of controversy around fluoridation that you can read about, but it actually has helped in reducing the cavities that are in the
Well,
population.
let's talk about that a little bit, because I know there was also a push about fluoride that maybe it was bad for you in some way, and there's some misinformation out there about that. Maybe
Right.
you as an expert in the, I know you're part of the professional society in the United States. Can you talk about what misinformation you're seeing about fluoride in teeth? And because I think that was a big change and for the positive for
Right.
people when we got, for example, toothpaste that's fluoridated, right?
Right. So there are some negative effects of too much fluoridation. Fluorosis of the teeth, which is when the teeth are forming. Too much fluoride in the enamel can cause discoloration and
So to get too
weakness
much
of the enamel.
fluoride, you mean you just have to ingest it, right? Or
You have to ingest it.
Yeah.
So through water sources, through toothpaste. When I was a kid, I'd make a toothpaste sandwich because it tasted so good, and that was apparently not so good for me. But the controversy.
Is that how you got taller than me? Then? Maybe I should have done that. Anyway,
But that's how the negativity around fluoride has started. There's also something called osteofluorosis that they've shown in elderly population, especially women, where it makes the bones, one of your major bones like your hips and your femur and all that, it makes it a little bit more brittle. So that's with too much fluoride. It causes a higher chance of fractures and that sort of stuff.
but for the most part, the fluoride that we have in our toothpaste is safe for us. Is that right? Or
Yeah, as long as you don't ingest it.
right?
Yeah.
Right. Okay. And that changed how we protect our teeth. Is that right? Okay.
Correct. It did change it a lot.
Okay. So that people aren't getting as many infections, I guess, right?
Yeah. So cavities are the main thing that fluoride prevents. There's a couple things. Obviously, with dentistry, you want to prevent gum and bone disease around the teeth as well, and that's why you get your cleanings and deep cleanings. And some people have a higher propensity for periodontal disease.
So when you say disease, are you talking about like infection? I don't understand all this stuff because, we just, the dentist that will come and tell me he's a great guy here. I think you know them, but you're talking about just infections in the gum area.
Is that area.
And it can become chronic. Is that right?
Become chronic. There's a huge genetic component to it.
Oh,
there's
okay.
also a huge lifestyle component to it as well in terms of hygiene practices. But we've found in the last many years, actually, that there's a huge genetic component to it as well.
And that, because we're gonna get to flossing in a little bit, but that can cause chronic inflammation in the body, right?
Correct. There's a lot of I have a good bunch of good friends, actually, a dental school roommate that's a periodontist, Jordy Bender, and there's a lot of research in periodontics that shows that it affects inflammation in your body, it affects your heart. It affects a lot of systems in your body as well. So there's a link to that. So if you have a clean, healthy mouth, then it helps have you have a clean, healthy body, and it's the gateway into the body as well. Through food,
right?
and
And just to
everything.
be clear, swear words can't cause dental disease. Is that that's not possible?
My kids
is
are
that
listening,
right?
so I won't be swearing today.
Okay. No, I'm just wondering. I'm sure there was a lot of swearing on Sunday.
There was a lot of swearing on Sunday
after halftime, but,
in the bathroom where my kids weren't at.
Exactly. So, speaking of hygiene, and I think you talked about the importance of it, and now why we do it. Besides brushing our teeth, twice a day, seeing the dentist, having someone else look and, make sure that everything's okay. I know my dentist does an oral cancer screening as well.
Correct.
And I don't think they were doing that before. Was that something that's new?
Since I've been in dentistry, we've been doing oral cancer screenings. So, I mean, the frequency at which people go to dentists, a lot of people go every 6 months. It's a opportunity for the dentists and the hygienists that are there to actually look in your mouth and say, hey, this doesn't look right. Mm-hmm. And let's get someone that's more of an expert, say an oral pathologist or something, to look at this.
Sure.
See if there are cells that are abnormal. Mm-hmm. And a lot of people's lives have been saved by dentists.
I mean, I completely agree. We've talked about on the podcast about how there's over 200 different types of cancer, and really you can get cancer anywhere. Mm-hmm. For me, I do treat head and neck cancer and tongue cancer. And so, people think it's generally associated with smoking, but there is a virus called HPV that can cause cancer in the mouth. So I think it's really important to just, get screened. Even
Correct.
You can have a scan, and scans will pick up things that are, bigger, like 1 centimeter in size, but, really having someone look at your mouth, and even your, this is for a dermatologist, but like, having the doctor look at your whole body if there's some abnormal spot or something, I think, as you said, just so important to continue to get screened. Because I think, we're all afraid to go to the dentist. We all, don't like your cash pay program. And, but ultimately, everything, to do anything costs money. And I think, prevention is something that I think, unfortunately, has gone the other direction a little bit in the last couple of years. And so I think, this is a conversation we're almost having on every episode of the podcast is how can we not get sick? How can we have less visits to the dentist?
Correct.
How can we? So one thing that has become really big that I know I need to work on is flossing, right? And there's even studies on flossing and cancer risk and stuff like that. So I just wondering if you could comment on the flossing aspect of how often, using the water pick thing and all those types of things.
Yeah, these days we have so many more advanced tools to help us out. The old school flossing is probably the best way just to get the bacteria out of your mouth, and good oral hygiene practices. I'm far removed from the dentistry world. I'm obviously just doing more orthodontics for the last 20 years. However, in my heart of hearts, I'm a dentist.
So flossing, mouthwash, and the obviously brushing your teeth and the water pick.
Yeah, there's a lot
all
of
that stuff's beneficial, right?
There's a lot of medicated mouthwashes that help. Consult your dentist and see if what's right for you.
Yeah.
A lot of over-the-counter products that you can buy. A lot of prescription products.
And what age should people start taking their kids to the dentist?
So, I have a good friend that's a pediatric dentist. She sees kids as young as 6 months old. When the first teeth start coming in, is typically what's recommended. And there's a range. 6 to 9 months is typically when the first teeth come in. Those are easy visits. Those are more training visits for a lot of the younger kids to make them less scared of the dentist. Train them in the sense that this is a lifetime thing that you're going to be going to the dentist on a regular basis. We don't want the kids to be scared. We want it to be a fun environment. There are some amazing pediatric dentists out there that just are so gentle and the nicest people in the world. I mean, I'm sure in medicine you see these pediatricians. We just interviewed
a pediatrician. I mean, I think to do that job, it's very difficult. And we've talked about this. You have to trust someone that's an expert at what they do.
Right.
And if you meet someone, I mean, you and I obviously are brothers. We love each other and all that. And but if you meet someone that you trust, stick with them. I really think that's like an important thing.
Every aspect of life. I mean, I only surround myself with people that I trust.
People have the best intentions for you, regardless of if you disagree on something or whatever.
And,
Go ahead.
And then you see that in your career. And I mean, My patients are just amazing.
Yeah, same with mine. I mean,
you,
they keep me going, man, to be honest with you.
That's the only thing, I mean, that really sparks my enthusiasm. Going into the office, having a smile on my face.
Yes,
I
that's
have
right.
a smile on my face
That's
every
right.
day.
That's right.
And I'm going to meet and re-meet so many different people,
Yeah, but I'd say like sometimes there's someone that's just not your style, or they don't, whatever, they're upset or whatever, and I just say that's okay, like
Right.
that's, you got to find, maybe I'm not the right person for you, or you're not the right
Right.
person for you, and they got to find someone that they are gonna,
Well, I mean, I mentor a lot of younger dentists, orthodontists, and
Sure.
my advice to them is always come from a place of love. And as long as you have their best intentions in mind, you're not going to do anything wrong. Some people need more explanation than others. I had a patient yesterday that was just not a happy person in life.
Sure.
Right?
I mean,
and you get it every day.
Yeah,
I
yeah.
get it every day. But my speech to my staff always is, listen, they may make you angry. They may say things that make you angry, but come from a place of love, and
Sure.
you will be treating them the best that you can.
That's right. That's right. I think that's a great philosophy for life,
Right.
So now we know, we kind of established the dentistry thing, and now we're going to talk about my least favorite thing, which I had to go through, and both of my kids are going through, where they take metal that they found in a junkyard somewhere and they put it on your teeth, and it's called braces, if anyone's wondering. I still wake up with nightmares from myself having braces. I'm sure my kids are going through that right now. And so maybe we can talk about first, is the purpose for fixing the teeth purely aesthetic, or is it also prevent infections when your teeth are straighter?
Both.
Okay.
Both.
So maybe you can talk about that.
Again, just like all aspects of medicine and dentistry, we've evolved over the years. Early orthodontics was very rudimentary. I mean, you'd have bands around each and every teeth that'd cut up your mouth. You'd have a long wire that's like about 6 foot long that you had to bend into a little arch or whatever. I mean, orthodontics was hard back in the day.
Yeah.
Modern orthodontics for us has gotten very technological, a lot of digital things that we use and a lot of technology that we use. For example, when nickel titanium came into the picture, which is a shape memory metal that they use on the space shuttle, to kind of scrunch up satellites and then release them into the air. That's the technology that we use to provide light forces on the teeth. I get a lot of parents these days. They're like, I don't understand it. All these kids want braces. They love it. They don't come out of the appointment like they're in pain and all this stuff. I'm like, that's our technology. I mean, it's not the same as when we grew up. Now they hardly feel anything.
Yeah,
and it's
they have a little
and
bit
the
of it,
braces
and then
are
they're fine.
smaller.
Yeah,
the braces are cooler.
Oh, yeah.
They got colors, and you got clear aligners where you can hardly see what's going on. And that's technology and material science. I mean, that's a huge thing in medicine and dentistry. Dentistry especially, and orthodontics especially, our material science has gotten so good over the years, and it's ever evolving. It's evolving.
It's an amazing thing.
Yeah, and I mean, in dentistry or surgery or whatever, anesthetics or pain management has gotten so good as well.
Yeah.
And I think that's why, especially in my field, I mean, I don't have to use any pain management, but in my field, it's people are actually looking forward to coming. We have the music blasting.
Yeah.
We have high fives all over the place.
It's similar in a way. You're like, no one wants to go, but at least if you have to do it,
Right.
at least it's a pleasant experience,
It's
right?
a pleasant
You try to
experience.
make it as pleasant as you can.
Right.
Obviously, it would be nice if everyone had straight teeth and they didn't get infections, and they didn't. We'd both be doing something else,
Yeah. So I didn't answer your question, but I mean, it is a bit of both. Aesthetic and functional and disease preventing. So if you have crowded up teeth, you can't clean them as well. So straightening out your teeth will help you clean them because you're your own dentist at home. I mean, your daily practices of hygiene are very, very important. Just as important as going to a dental professional. However, straightening them out will help prevent a lot of these gum problems or cavities, and then function of your teeth in terms of the muscles and the joints that are around your jaw. Getting the teeth into the correct position actually helps that a lot as well. You've probably heard of TMJ disorder or TM.
Yeah.
Yeah. So it helps in a lot of those aspects as well. And then you can't discount the aesthetic portion of it.
Sure.
I mean, stress kills you, right? We know this.
Yeah, no question.
I mean, you're an oncologist.
Yeah.
You know that a lot of this cancer comes from stress.
I mean, it increases inflammation that
Right.
increases your risk, certainly.
Right,
Yeah.
exactly.
And we've actually talked about that needs to be more talked about in terms of one of the health things that all of us do. Sleep is one of those things, but decreasing stress, whether you pray or meditate, whatever you need to do to give yourself, that downtime, I think is really important for your overall general health. No question about it.
No, I have plenty of anecdotes where there's this little shy boy or girl that comes in that has really, for the lack of better words, messed up teeth.
Yeah.
And they blossom into this confident,
Yeah, exactly.
Maybe
someone's
young
making
adult
fun of them.
Yeah, exactly.
Yeah,
and I mean, the parents tell me all the time, they're like, their personality completely changed.
When you have confidence
when they
and
when they have confidence,
just
they have
the way
nice
you
straight
look
teeth,
and-
they have beautiful smile, and it opens a lot of doors for them.
It's amazing. Yeah, that's fantastic. People discount, the way you make them feel. I think it's the same thing for me when, we see people, we want to make them feel good if we
Absolutely.
can, So
Absolutely.
that's an amazing thing. When is the first age? And first of all, do adults can get braces too? I'm assuming.
I have a 90-year-old in braces right now.
That's awesome.
And she's going to live to 120. She's
in good shape.
A marathon runner.
Oh, good.
She's going to live to 120, and her,
Well, she made it to
some
90, so she's already got the genetic component.
Yeah.
Because the average age is 80, so yeah.
Her speech to me when she came in is like, Doc, for the last years of my life, I just want to smile.
Yeah.
And I will give it to you. I mean, as long as everything's healthy and I'm not doing any harm, I'm going to give you whatever you want, and you're going to smile to the, till you're 130.
Yeah. I have a Taekwondo instructor in my practice who's in his mid-80s. And he says, Doc, I just outlive all my doctors. So when you get the reason I don't get old is when you get old, I'm gonna see a different doctor when you get old. I was like, that's fantastic.
Is he a vampire
man.
or something?
Yeah, no, he just keeps going, man. It's great. It's great to see, these people that are still happy and healthy at this advanced age. And I think one of the things that's the point of this podcast is what are the things we can do to prevent seeing, for you. No one can prevent seeing your field, because I think everyone needs a dentist. I think about it for me, how can someone not see me? How can I decrease my patient load? What are all the preventative things we can do? And I think I almost think of your service as a preventative service in a sense, right?
Correct.
Because my idea of dentistry is Tom Hanks on that, what's that movie where he's on the island by himself? Castaway. And he's pulling his teeth out with the thing. So that's
with a skate.
With the skate, yeah. So that's my idea of, man, that guy did that. I can't imagine how painful it is. And we've all had some pain from our teeth at some point or another, right? And how can we, prevent that? And how far have we come? Because, 100 years ago, there was no such thing as dentistry. Was there dentistry or braces 100 years ago? I mean,
100 years ago. So actually, Edward Angle was the first guy in orthodontics that created like the Angle's classification system, and
it's still around? From 100 years ago?
Yeah, actually more than 100 years ago. 1899.
You need to change. You need to create your own classification system and call it the Shah. I mean, nothing should be the same way.
Changed, but
I have this whole thing about if you're not changing, if things are not, if you're doing the same thing you did 20 years ago, things aren't getting better.
We've built on it.
I run away from the doctors that are doing the same thing. But what I'm saying is, so we have the staging system for Hodgkin lymphoma. It's called the Ann Arbor staging system, and it was like in the 1970s.
Right.
And we still rely on that. And I just think sometimes things can be improved. That's all.
Of course.
You know, I look back at some of the things I write in my notes, and I'm like, man, we have different medicines. Things should be different.
Right.
So.
Absolutely. Innovation is great, but however, I have an anecdote for you as well. When I bought my practice in Matson, amazing mentor that I bought my practice from, Dr. Manassi, and
that's fantastic because that doesn't usually always go good.
It's
you know,
till this day. I mean, once a week we'll text each other. He'll send me pictures of him golfing and
that's great.
You know,
so he didn't
skiing
leave you,
or whatever.
He gave you the advice that you needed
he gave me
to
the
continue
advice.
to.
It was amazing. But things that he was doing back then, I was like, oh, come on, man, let's just do new things. And we've come full circle. Because I have some assistants that are still with me since that time, almost 20 years ago, and they're like, "Oh, this is what Doc used to do," you know? That's what Dr. Manassi used to do. I'm like, so you can't discount the fundamentals.
There's wisdom in all that.
There's wisdom in that. But we innovate.
And I think learning that stuff and where it comes from is interesting to me.
Right.
As we move. Forward. Speaking of that, what's the most common misinformation you're seeing when people come to the office? What's the most common thing that people are telling you they're seeing online or whatever that you're like, listen, we're not here to judge people. We're not here to, people can think and say and read but I think when you have an open relationship, like my patients will come to me and say, hey, I heard about this thing that I read in the paper. Perfectly okay, you know, for them to ask me I want them to feel comfortable. Right. So what's the things that you're seeing that in your field where people are coming in and maybe, there's not enough research or data behind it? Sure, anything can be true. I could get in a car accident on the way to Indiana today. But what's the thing that you're seeing that really hasn't been proven?
I mean, our favorite our least favorite doctor is Dr. Google, correct?
Yes.
Of any medical professional out there.
I would say, well, now we have Dr. ChatGPT, but,
Or Dr. Jill Biden,
But, medical-wise, what are you seeing?
Medical-wise, what I'm seeing is, a lot of misinformation. There's nothing specific. A lot of the kids come in and this is going to hurt so much. It comes from the parents sometimes because that's what they experienced throughout. Yeah,
I was scared for my kids, man.
Exactly. So
I was
that's something that's changed a lot. So that's one of the. If something were to stick out, that's one of the things. And then of course, material science. Right now, the push is for less plastics in what we're ingesting, less metals in the body. Nickel is a problem. Mercury is a problem. So these are a lot of questions that some of, not my young patients, but my older patients are asking me, okay, well, what kind of metals do you have that you're putting in my mouth?
Oh.
What kind of acrylics are you putting in my mouth? Are they going to leach? And there's a lot of research that's in dentistry and orthodontics about the safe materials that we can that non-leaching safe materials that we're putting in people's mouths so they don't create more problems.
Okay.
And that's my job to educate, just like your job is to educate and to say,
safe to do what you're doing. Got it.
Exactly.
Yes.
And also maybe there are people that need a little bit more, and I've compiled a list of good research that I can actually give to them and say, hey, listen, I'm sure you saw this somewhere, wherever you saw it. However, this is the research that I've, and if you're interested, I'll email it to them and say, hey, look, these are the studies that we've looked at, and that shows that whatever we're putting in your mouth is safe. For now, again, the future, things change. People are taking GLPs up the wazoo right now. Yeah. And who knows if it's safe. Right, for now, we know that it's safe,
Yeah.
but
We have 10 years of data, but maybe at
yeah.
20 years.
exactly,
we
or
don't-
50 years or whatever it is.
We don't really know. I mean, yeah. So no, things change, right? And
exactly.
we need to change with it, right?
Exactly.
And I completely, agree with that philosophy. So yeah, it's I mean, I think people are allowed to ask questions. I do the same thing. I think most universities have reputable information on their websites.
Mm-hmm.
So usually I'll refer. I mean, I was at Rush or Mayo Clinic or anything like that. So that's interesting. I didn't think about that. So that's why I do this podcast, is just to I learn a lot from you, because even though we hang out like at least 2-3 times a month,
Right.
we don't always talk about this stuff.
We
right?
don't.
And I always discount that. Hey, this is my friend or my cousin or whoever. Like my friend Zoe. I mean, I've known her for 30 years, and like we've never talked about. And that's one of the reasons I'm doing the podcast, is I feel like I'm getting education from people that I know who are experts at what they do.
Right.
Because to me, an expert means time doing something, because nothing can substitute this experience that we have. I've learned that nothing can really substitute that.
Yeah, 10,000 hours, Malcolm Gladwell.
We're every time there's a doctor that's we hire, like I know that they're not going to know everything the first year. It just takes some time. So I mean, and I think proof of this is the Bears, right? I mean, you guys in Chicago think that the Bears were just going to win 17 games, 17-0, and you're going to turn it around. And
hey man, as long as we don't go 0-16, we're better than you.
It's that's true, right? The Lions are the only team that did that. Yeah. So speaking of that, like, how many games do you think the Bears will win? I just want to hear it from you, because we're going to hang out at least. I'm hoping, if my luck is still good, you and I will be hanging out at least once a month for the rest of our lives. And so
120.
So my question is, like, really, I want to remember this statement and make sure to make fun of you about it later.
Absolutely.
And so how many games do you think?
So before the season started, of course, Bears fans are very passionate, just like Lions fans are. And I was hearing numbers like 13 wins.
It's so crazy.
I was skeptical.
So
I was skeptical. I mean, I'm a cautiously optimistic Bears fan. I've been a season ticket holder for many years, and my prediction at the beginning of the season is 9 wins, and I will probably reduce that to 6 wins right now.
Oh, wow. Yeah. Crazy. Yeah, I'm hoping the Lions, they have a tough schedule. They have I think 5th toughest schedule. I think we can get to 10.
I think you can get to 10.
I think we'll at least do 10, and hopefully closer to the 12 category. We got to stay healthy. I mean, last year we just couldn't stay healthy.
Oh, the Eagles are tough, man.
Eagles and Packers obviously are good. I think that's the class of the Bucks look good. So we'll see. I think some of it's just, I realize now in the NFL, some of it's just health, like
absolutely.
you lose a few players, and, it's just not going to work out for your team,
Absolutely. So, there's been championship roster teams that have lost 1 or 2 players, and
I mean, when Brady, that one year he got injured, the Patriots still won 10 games, I think, but it's just not the same. Some of these guys are such at an elite level that, it's not going to be the same,
Absolutely.
So, but anyway, I want to thank you for taking care of the thousands of patients and providing this education.
Thank you.
I don't know if there's anything else that you want to talk about to the general public. I know.
No, I'm super proud of you. I mean, I've listened to every single episode, and I love what you're doing. And keep on doing it, and
Thanks.
I think you're going to be very successful.
Well, I mean, it's just for fun, man. We talked about this.
No, but even fun can be, success generating.
As long as it's, real, and it's just, we're focusing on the data and the science and the philosophy of people not having to see us as often. Like, the whole goal of this is hopefully people will listen, and then maybe they won't see doctors and dentists as often.
I never want to see you in your office as a patient. Let's just say that right now.
Well, as you know, thankfully, I'm lucky enough that people, put their trust in me, and I think, as you said, our patients give us the best, feedback in terms of, keep us going, right? Because there's a certain point where you're an expert, and financially you're doing well, and so am I, and you're like, hey, you know what? Like, why am I doing this? And I think the patients drive us to do it. That's why we enjoy it. So thank you for putting your trust in the Dr. Shahs of the world. Not the world, but at least us too. And
the Chicagoland area.
Chicagoland. Well, I guess Northwest Indiana is Chicagoland. So, and I can't recommend you more, although I know how busy you are already. So, I have a gift for you that you have to wear.
I have a gift for you too.
Okay, good, fantastic. Well, anyway, thanks again, and we'll see you next time. Hopefully, we can do this again, maybe next year or something like that.
Absolutely. Thank you so much.
Take care.